I've unfortunately had lots of doctors in my life at various times, not all but of various sorts, and I would like to say that they were all great experiences, and I have to tell you that actually it's quite opposite. I came to Dr. Ginsberg the first time out of, it seemed like almost desperation. I live on the West Coast in California, and I had my first eye hemorrhage. I'm a diabetic, and apparently that often does come as a diabetic complication, but I had never had one or experienced one before. And so I went to see an ophthalmologist there, and although he was competent, I think, I just was not really very happy with the care I was getting. And so I called a relative of mine, my uncle, who's an ophthalmologist, and he said, "Jules, you have to call Dr. Ginsberg." He said, "You need to call him." And I said, "Okay." I called him and made an appointment and flew in from California, and pretty much the rest is history. After my first time of seeing him, he was a big reassurance that I wouldn't be going blind, which was one of the biggest kind of fears of my childhood. I was diagnosed as a diabetic at age 12, and from very early after my diagnosis onward through my 20s, I was told that by the age of 40 I would be blind, and it was not really anything I could do about it, but I would go blind. And you know, it just didn't seem like, what do you mean there's nothing I could do? And so, although it was a side note when I came to Dr. Ginsberg, because I came because of an eye hemorrhage and more of an immediate problem, I discussed this with him, and not only did he listen to me and hear what I was saying, he looked at me and said, "I promise, under your care, you will not go blind." And it was, I mean, I trust him, and he's making that come true. So I came in today, and the bleed is almost gone, and I knew that he'd be able to see through my eye, and we're going to do some laser surgery, I believe, to help with any future bleeds. And I think he also wants to do an OCT and some other tests just to see the status of the bleed and make sure there's no further complications.
So what we're seeing right there is the arteries and veins have filled up. We're doing an OCT at the moment. This is kind of like looking at every level of the retina. This is the only machine, as a matter of fact, anywhere that can link up an OCT. Think of it like an MRI of the retina, and we're able to link up exactly where it is on a fluorescein or on an ICG, which gives us really an amazing amount of information. Here you can actually see the different levels of the retina. Think this is the thickness of cellophane, yet we're able to see every level from the nuclear level to the photoreceptor level. It's really something wonderful.
You walk into Dr. Ginsberg's office, and I might sound, might be a little corny, but I mean, the staff helps you. I mean, they're nice, they're friendly, and then you get shown into Dr. Ginsberg, and he's such a human, he's a human dynamo, but then he comes and he's this big smile on his face. I mean, you're excited to go to the doctor. It's kind of a strange feeling. Finding a doctor that, one, listens to you, relates to you, even if he hasn't had experienced, what you've experienced, understands both biologically, physically what's happening to you, and as human, understanding what's going on with you, it's priceless. And I feel like all my questions and problems with any other doctors I've had in the past have been really solved with him. I mean, he's really what I'm looking for in a doctor.